Before beginning the laser use, it is necessary to install a 9-volt lithium battery into the base of the foot control. The battery compartment is opened with a Phillips head screwdriver. After installing the battery, reinstall the screws. For laser use, be sure to depress the pedal as opposed to the safety cover of the foot controller. The unique part of the Pioneer Pro laser system is the fiber cartridge, which houses and safely stores the fiber optic cable. Install a foot pedal control antenna into its receptacle. Now install the power cord into its receptacle. The remote interlock is an optional accessory control. The main power switch may be now turned on. Check to see that the emergency stop switch is in the open position by twisting it to either side and allowing it to pop up. Insert the key into the key lock mechanism and turn it to the on position. Put on the supplied protective safety lenses. All personnel and patients within 10 feet of this laser device and target tissue must wear safety glasses during any lasing operations. The laser sign must be in place to alert others that the laser device is in use. Extend 2 to 3 feet of the fiber by pressing the extend part of the rocker switch. Remove the stripping tool from its packaging. The outer jacket of the fiber must be stripped away from the protective cladding and glass fiber. The cutting blades of the stripping tool are located here. There is a millimeter ruler guide along the upper stripper arm. Strip between 10 and 15 millimeters of the jacket from the fiber. Insert the fiber in the insertion hole of the tool, and the fiber can be seen in the channel of the tool. Next, grip the tool enough. Support the fiber with 4 fingertips and quickly pull the jacket away. This will allow enough cladding to support the fiber against breakage, as well as engage the collet of the handpiece. The stripped jacket can be removed from the stripper channel by tapping it against a hard surface. Cleaving is perhaps the single most critical factor in preparing a fiber for safe and efficient use. This step is similar to cutting a pane of glass. That is, a sharp instrument is used to scribe a scratch on the glass surface. The glass is then tapped to initiate a controlled breakage along the scribed line. The same is true of cleaving a fiber. Support the fiber securely on a flat surface with 4 fingertips. A single silent scratch, about 6 millimeters from the end of the fiber, will be sufficient. Then grasp the fiber and quickly break away the short length from the remaining fiber. Activate the aiming beam by pushing the Ready button on the control panel. To check the optical quality of the cleave, hold the fiber about 10 to 15 millimeters away from a smooth, light-colored piece of paper. A nearly perfect circle of red light indicates a good cleave. A comet effect radiating from the circle or uneven intensity of light indicates a poor cleave. Recleave the fiber if this is the case. The cleave fiber may now be placed into the handpiece. First, loosen the fiber locking tip on the distal of the autoclaved handpiece. Feed the fiber through the opening of the cap and through the locking collet until it appears in the medial opening. Then select a disposable tip and attach it to the handpiece by swedging it onto the end of the handpiece. Then straighten the tip somewhat to allow the fiber passive passage through the tip and extend about 3 millimeters past the opening. Now rebend the tip and fiber simultaneously to the desired angle for access to the target tissue. Now lock the position of the fiber by gently tightening the fiber locking cap, so the exposed fiber will not easily move within the tip. Over-tightening will damage the fiber and/or collet. The Pioneer models of lasers are essentially low-powered devices. In order to reach surgical vaporization temperatures, it is necessary to introduce dark ink onto the surface of the cleave tip. This is best accomplished by using thick articulating paper and firing the laser onto the paper with a power setting of about 1 watt. Try to avoid piercing the paper with the fiber tip, as this may cause some melting of the cladding. The purpose of the cladding is to prevent photonic energy from escaping the side of the fiber. Use of mylar-based articulating films is contraindicated due to the lower melting point of the mylar and the possibility of causing combustion of the film. Fiber initiation is not indicated for therapeutic or non-surgical applications. If not on already, turn the key switch to the on position. Select the power setting appropriate to this procedure, either by your experience or by selecting one of the user-programmed preset settings. The aiming beam intensity may be raised or lowered by pressing the aiming beam button repeatedly. Use the mode button to select either continuous or pulsed mode operation. The symbol for continuous mode is 2 horizontal bars, and pulsed will be 2 vertical bars. Continuous wave will ablate and coagulate inflamed tissue better than pulsed mode, and the pulsed mode will coagulate and cut normal tissue well. Novice operators may exercise better control utilizing the pulsed mode. Pushing the Ready button will put the Pioneer Pro in active mode, and laser energy will be emitted once the foot controller is engaged. Disengaging the foot controller will stop the emission of laser energy. The device will return to the standby state after 4 minutes of inactivity. The laser is now ready for use.